Hi, everyone. Good afternoon, and thanks for joining us today. My name is Sean Godar. I'm the Vice President of Strategy and Analytics at Employers Health and a co-director of Right Direction. I will serve as a moderator of this event. We are very excited to hear from today's speakers, but before we begin, a few housekeeping items. All attendees are currently in listen-only mode, so please send any of your questions that you have using the question function in the control panel. We look forward to addressing your questions at the end of the presentation. If you ever have any difficulties hearing me or any of the speakers, please raise your hand in the control panel and we will be in touch to assist. Upon exiting the webinar, you will receive a survey to provide feedback. We appreciate all attendee feedback in order to provide future valuable education opportunities for upcoming events. And we will also send up a follow-up email tomorrow with the link to recording. Please submit your questions anytime in the chat function, and we will answer those during the Q&A session. Now, it's my pleasure to turn it over to my colleague, Darcy Grudadaro, who is the Director of the Center for Workplace Mental Health and fellow co-director of Right Direction.
Thank you, Sean. It's a pleasure to be here, and thank you all for joining us. We're really excited today to engage in a conversation with a very impressive group of panelists. We're going to just tell you a little bit about Right Direction before we get started. So you can go to the next slide. Right Direction is a partnership between the Center for Workplace Mental Health. I'm the director of the center at the American Psychiatric Association Foundation, and Employers Health, which is a group of employer purchasers who work across the country to bring information to employers about healthcare purchasing, but also about mental health and well-being. So if you go to the next slide. Right Direction is a high-impact turnkey initiative to raise depression awareness, reduce stigma, and promote help-seeking behavior. We've done this series of town halls, and they've been extremely popular. And really, workplace mental health is a very important topic to employers in all industries of all sizes across the country, out of recognition that mental health is part of overall health and well-being, and that there is no health without mental health. So it's a very important time to really be focusing on how do we raise awareness, especially around depression and anxiety. We know these are conditions that people are experiencing in very high numbers. Generally, they are about at 20%, but with the pandemic, we know the rates are much higher, especially for young professionals and young people. So we have had this series of town halls, and we've had an opportunity to speak with a really impressive group of people on a variety of topics. And changing the conversation is a topic near and dear to all of our hearts within the Right Direction community. So if you go to the next slide. It is my pleasure to introduce our panelists, and I'm going to share with you their name and affiliation, and then I'm going to allow them to tell you a little bit about themselves professionally and personally as well, if they're interested. So we have Bob Beamer, who's the Director of Criminal Justice Information Services and Corporate Facilities. He's the Corporate Facility Security Officer at Microsoft. We also have Nora Super, who's the Senior Director at the Center for the Future of Aging and Executive Director of the Alliance to Improve Dementia Care at Milken Institute. And then we also have Michelle Tenzik, who's the CEO and founder of East 10th Group. Sorry, I'm a little tongue-tied today. So we're delighted to have all three of these really accomplished professionals. And now we'd like to hear a little bit more from them about their professional lives, but also all of them live with a mental health condition. So we really want to talk today about their professional careers, performing at such a high level while also managing a mental health condition. So Michelle, let's start with you. If you could just maybe spend 2 minutes and tell us a little bit about your professional journey, that would be great.
Sure. Thank you so much, Darcy, and welcome to everyone who's joining us today. Really terrific to be here. As Darcy said, I am the CEO and founder of East 10th Group. We are a leadership and executive coaching consultancy based in the New York area. And I founded the company after having a very long storied career in human resources across many different industries. And I'm also very proud to say that I serve as a board member and a stability leader of the Stability Network that is a partner of Right Direction. So Very happy about that, and did in my corporate career get to the top spot in human resources, served in a variety of HR leadership roles for, again, a variety of different companies. So I'm very knee deep in the world of leadership, human resources, support of employees, and whole of organizations. And also I do live with depression and anxiety on a daily basis. That's my mental health condition. So I'm happy to be sharing about that today.
Great, thank you, Michelle. We're really delighted to have you. And I'm glad you mentioned the Stability Network, because we reached out and we're really excited about the opportunity to partner with the Stability Network, a wonderful organization of professionals, really helping to change the conversation in their own right. So we really are happy to have that partnership growing, and we hope growing into the future. So Nora, let's hear a little bit from you about your professional journey.
Sure. Hi, everyone. My name is Nora Super. As Darcy mentioned, right now I'm at the Milken Institute, where I lead our Alliance to Improve Dementia Care, and I'm the Senior Director of the Center for the Future of Aging. I've worked in the Washington, D.C. area for the past 30 years, many policy jobs that I've done both in nonprofits and within government. I had the honor and privilege to work at AARP during the passage of healthcare reform. I was their chief health lobbyist during that time. And then after I left AARP, I served under President Obama as the executive director of the White House Conference on Aging. I'm also a mother of 2 daughters. They're now in their 20s. I was divorced once, and I'm now remarried and have been remarried for 17 years. And I also live with anxiety and depression, and am happy to share my story about how I've managed that along with my career as our conversation continues.
Fantastic. Thank you, Nora. That's great. And then Bob, we'd love to hear from you as well.
Sure. My name is Bob Beamer, and as you stated, I work at Microsoft in the compliance arena around a lot of our cleared government contracting work. After graduating from college, I was commissioned as an officer in the Marine Corps, where I spent several years as an intelligence officer doing some high-speed, low-drag kind of stuff. Got out of the Marine Corps, went to work for corporate America, and now here, 20-some years later, I've come full circle and am doing very similar work to what I did when I was in the military. I'm a recovering alcoholic, and my experience, my exposure to the mental health issues that we'll talk about here today didn't occur until I went to rehab and stopped drinking about 9 years ago. And that's when a lot of things emerged for me that I didn't understand and didn't know how to contend with. And since then, I've been diagnosed with PTSD, ADHD, and then obviously anxiety and depression roll in really tightly with all of that. So I'm excited about the opportunity to be here with my colleagues and with you all here today to talk through this stuff.
Fantastic. Thank you. We're really happy to have all 3 of you. So let's jump right in. We have with us today a number of employers, people who work in HR, benefits, but also in operations. So I want to ask you, as you face some mental health challenges throughout your professional career, what policies and practices and kind of what was it within the workforce that you found extremely helpful as you managed a mental health condition, and what really made the difference for you in terms of managing your condition? And Nora, we'll start with you.
Great, thank you. Well, I've had 4 episodes of major depressive disorder since I was 41. I'm now 57. I work in aging, so I'm proud of my age. And during those times, I was unable to work. I couldn't function. And I think that the things that helped me the most throughout the course of my career were Family Medical Leave Act, which I was able to take at a time where I wouldn't lose my job if I took time off from work. I also, had positions where I had paid leave, where I could use sick leave and vacation leave to be out. And those things really saved me in my career and ability to do that. I wasn't open and honest about why I was out of the office until my current job. And I think that's really related to the stigma associated with mental illness and the fear that if my employer knew, that they wouldn't be able to trust me to do the job that I do. So I decided to go public a few years ago, actually after Kate Spade and Anthony Bourdain had both died, because I was frustrated with what was being said in the media about, oh, they're so successful and why would they do this? And this is a selfish thing. And I thought, you know, these people writing all this don't understand depression at all. So I think that for me, I've decided to go public because I want to try to help other people that might be going through it, but I also want others to understand what it's like for those of us who have episodes of severe depression, and that we can't just get over it, as Cher would say, that there are, you know, things that we really, that's really, really hard to function during that time. And so I think, you know, a little more understanding and empathy from employers would go a long way to help people feel more secure when they're experiencing a tough time.
Yeah, I think it would be helpful too to understand, you know, what does empathy mean in terms of how it gets played out? Because I think a lot of employers, they may hear that, but I think understanding what does empathy look like, what does it feel like if you're someone on the receiving end? I'm just curious about that before we move on to Bob.
Sure, happy to say that. I've been a supervisor for quite some time now in my career, so I've had the opportunity to also supervise people who have mental health conditions, and so I hope I act in a way that you know, I would encourage other supervisors to do. And one thing I do is suggest that people take accommodations that they're allowed under the Family and Medical Leave Act. Often people don't know that they can do that, and that can help. Now that many of us have been working from home during COVID, we understand that we can be very productive at home and do other things, but many people that are going through mental health issues, I have one employee who had, for example, irritable bowel syndrome, which is closely associated with some mental health conditions, and she physically couldn't be in the office, and she was afraid to say why. And you know, once we talked about it, and I said, why don't you just work from home on those days? And that worked out well. It reduced her anxiety a great deal. It allowed her to be more productive, and also to not be afraid to tell me what was going on. I think the other, when I say empathetic, I guess, is to just understand, as I was saying earlier before, many people who haven't experienced depression sometimes think, you know, all we have to do is will ourselves to get up out of bed and go into work and just need an extra little push. And it really is a biological disorder, and it affects different people differently, but many people, when they have a major episode, really have difficulty even taking a shower. Even the smallest activity can be very difficult in spiraling thoughts, etc. So I think recognizing that these individuals are unable to work, that it's not our fault, that there's not anything we can do to make it better. Now, I certainly have tried everything, and I know a lot about mental health, and you know, I exercise, I eat well, I meditate, I see a therapist, I take antidepressants, you know, I do everything that's recommended, but I still get depressed. In fact, I got depressed again this February, despite everything I know about depression. And one thing I struggle with is telling myself it's not my fault, because I feel like society makes us feel like we're doing something wrong. And so when I say that, more empathy, I just think more understanding that no one hates being depressed more than the people that are depressed. And so I think that just a better understanding from employers that this isn't something someone's faking or wanting to get out of work, that it's a serious mental health condition, and there are times when people are just unable to work.
Yep, that's great. Thank you. Thank you for sharing that level of detail. I think that's so helpful to raise the level of understanding. And then Bob, for you, you know, can you speak a little bit to your challenges and that you've experienced with a mental health condition and some of the things employers have done that have been really supportive and helpful?
Sure. So again, my my entry into this space occurred when I recognized that I had an alcohol problem that I just couldn't surmount by myself. So I checked myself into rehab the day after my 45th birthday. And Microsoft is a very progressive company, and I'm very fortunate for that. And we've got a fantastic health insurance plan as part of the benefits and part of the company taking care of its people. So I was fortunate enough to have a workplace where they would allow me to go to rehab, and then there wasn't a whole lot of stigma associated with that piece of things. The medical coverage was fantastic. I had to pay basically nothing to go to rehab. I came back from rehab and I was accepted, and people initially kind of treated me with kid gloves. It makes office functions difficult when you don't drink and everyone else does. But I learned to deal with that, and after a while, as I started explaining to people that I've stopped drinking, it became less problematic and less almost embarrassing to admit that I wasn't drinking in a culture that kind of did. But then again, after I stopped drinking, that's when these other problems started manifesting: anger and lack of focus and frustration and apathy and a lot of different things that started taking over. And I was afraid to get help for those things. I was afraid to let anybody at work know what was going on there, because that piece of the mental health pie was not very well understood. There wasn't a whole lot of conversation about it. And there was, to Nora's point, there was stigma associated with it that I just wasn't ready to contend with. That being said, I felt like I had relationships with a couple of people at work, and when I shared my story with my boss, initially there was what appeared to be support, but then later on, that information was used against me. And so that was one of those things that the company did not handle well. That being said, though, you know, I stayed working at it. I've done all the things that Nora spoke about: therapy, medications, meditation, exercise. You know, I'm doing the right things. I sought professional help and I follow that direction. And I've also become very knowledgeable about mental health just by virtue of the fact that I have to understand what's wrong with me and deal with it. So I took it upon myself to learn a lot. Now, over the years, though, again, Microsoft's progressed considerably. It's a very evolving company and a very progressive mindset. So mental health awareness at Microsoft is night and day different from what it was when I stopped drinking and started experiencing my problems. Mental health awareness campaigns, the entire, during mental health awareness month, the company had something going on every day, basically. There are speakers, there are now employee network groups, there are places that folks can go to either talk to people with similar issues, and there are also places where people can go to seek professional help. And so the company is much more open to that, and I think that's just a fantastic step in the right direction. And then, for example, all of us belong to the Stability Network here on this call. Catherine Switz, our director, the leader of the Stability Network, came to speak at Microsoft, and that's when I became inspired to share my own story, because when she shared her story, not only was it validating, it was also encouraging, and it was also inspirational. And I thought to myself, that's what this place has been missing. That's what I want to be a part of. And so that's part of why I'm here today. But that's also, again, a key turning point, if you will, in Microsoft's evolution towards understanding and embracing employees with mental health issues.
Great. And just a quick question. I heard great things about what Microsoft has done around workplace mental health. As you think about what has been done at Microsoft and the commitment, what would you say are kind of the one or two things they've done that really made a big difference? I'm just curious as to if you could zero in on kind of one or two things that's been done.
Sure. I think one of the big things, and it's not just tied to specifically mental health issues, but Microsoft has a chief accessibility officer. So there is a position in the C-suite level, if you will, for an individual who this is their charter, is to help employees with disabilities, whether they're physical or whether they're mental, thrive in the workplace. and develop policies and raise awareness and provide training, if you will. So I think that's fantastic. And then again, the Mental Health Awareness Month was amazing. And I think I was thinking about it as Nora spoke. I think some of it has to do with recent events around, Anthony Bourdain and other public figures with mental health issues. So between those two things, having a person who's dedicated and then having a culture that allows for awareness to be raised and sustained and perpetuated, I think those are the two big things I would say worked well.
Yeah, that's great, and great timing because we are on the cusp of May is Mental Health Month. We're just about to enter it on May 1st. So really great to mention that. I appreciate that. And then Michelle, how about you? What is it that you have found in terms of managing your condition? And then also, what have employers done in your experience? I know you're leading an organization now, but maybe you can talk a little bit about that as well. But what is it that's made a positive difference for you?
Yeah, it's interesting. Thank you so much, Nora and Bob. Really terrific hearing what you both had to share. And I would say my story is quite similar, Nora, to yours, where I've had major depressive episodes and anxiety that landed me in hospitalizations. I also have tried to hurt myself, and I am still here, thankfully, today. And those episodes, I would say at the time that they happened for me, my last major episode was in 2006, although I certainly have had depression since then, but on a lesser scale. All the employers, we had the ADA passed in 1992, the American with Disabilities Act, so certainly I had certain rights under that. I had FMLA afforded me and so forth, and in some cases I had, support in the organization to get the treatment that I needed. However, what I would say was missing is the longer term support that individuals like me need. There's a certain point where we tire of a challenge, right? And we're sort of like, okay, you're better now, right? And everything's okay now. And that's not actually how our illnesses work. It doesn't, I don't wake up one morning and everything's okay again. It's a lifelong illness that I live with. And so I think that's where the openness and work environments that we're starting to see, and Bob just talked about in his organization, is amazing to me. And it's what's needed, is to make our work environments a safe place to have conversations around mental health, and to help all of us who are living with these conditions know that, yes, there's the expectation that we perform in our jobs, that we do well, that we're productive, making productive contributions as workers, but yet understanding that, what I might be experiencing with my mental health condition, I may need certain accommodations. I may need certain, come in at 10 o'clock as opposed to 8 a.m., but I'll stay till 7 because that's a better time frame. So there's all sorts of tweaks I think that can be made, but it really starts, and it goes back to Darcy, what you said, is that those empathetic leaders who either are coming forward themselves and talking about their lived experience, which we know is challenging, but here's 3 examples today that are doing that in the 3 of us, but also really listening. I mean, empathy comes with, it's not sympathy and, oh, I'm so sorry to hear that, but it's really doing an active listening role to what my organization, what my employees, and what my team members really need, and then making the choice that I'm going to take an action to actually put something in place to further support them, like I just heard Microsoft is doing, which is amazing. I mean, that's exactly what we need. And we need those organizations like a Microsoft and others talking about what they're doing very publicly. We need to see press releases, not because they're bragging, but because they're sharing what is maybe working in their organizations to create safe and comfortable work environments that other organizations can learn from.
Great answers all around. And one thing that comes up, I know we didn't discuss this as a topic, but one thing that I hear a lot in working in workplace mental health is there's this fear that, like, if we talk about mental health, it'll open the floodgates, you know, that people will just ask for so much. And yet what we know is that only half of people with depression, for example, get help and get the help they need. And of course, we know stigma is a barrier, but I would really like to hear you speak to that issue of, like, if we talk about depression, you know, it'll open the floodgates, and legal and compliance say we can't do that. And yet younger people, we know, have young professionals coming in, highly qualified, like all of you who are starting their careers, expect to see mental health visible. So I'd just like to have you just kind of comment on this whole idea of opening the floodgates. And Nora, maybe we'll go back to you to start that whole conversation.
Well, that is a common fear I think people have, not just with mental health. It's really any policies. As I said, I've worked on public policy for a long time. We call it the woodworking effect, that people say everybody's going to come out of the woodworks if we offer this to people. And, you know, 9 out of 10 times that just doesn't happen. People, you know, want to work. They want to be productive. They don't want to take time off that's not needed. People, I know for myself, my job is a very important part of my mental health. It gives me a sense of identity, of purpose, and of what I'm doing. I think, you know, when Bob was speaking, it made me think of, you know, in my situation, what happened was we'd put on a lot of events, and I agreed to speak publicly about my depression at a public event, and had many people come up to me afterwards. And it is very helpful. One of the reasons I love being part of the Stability Network is you see how much inspiration and how you can reassure people that they too can recover. But what I found when I got depressed this February, as open and wonderful as my employer was about me disclosing it publicly, once I got sick, nobody wanted to talk about it. You know, it still became like uncomfortable, and you know, something that we just sort of tiptoe around, like, oh, okay, Nora's out. Let us know when we can talk to her again. And, you know, it's still just like any physical illness. It'd be nice to get a, how you doing? You're okay? Checking in, something like, rather than just putting in your note, you know, notice that I need to be out for 4 weeks. And I think that that's part of the conversation. Don't just have it be lip service. Don't have a big, you know, tell everybody about the EAP and all these resources available, but then if somebody really needs time off, then suddenly you don't want to talk to them about it, or give them support that they might need help. So that's definitely one area where I see that, you know, employers, it's great applauding that they're putting forward proactive, but to, you know, Michelle's point, really show that empathy, really listen to people, what they're going through, what they think they can and cannot do. And mental illness is tricky. You know, as a supervisor, I found one of my challenges, I have seasonal affective disorder, so I tend to get down in the winter, and that's also the time of performance reviews. And initially, I had trouble telling people who reported to me because I didn't want them to think their performance review wasn't valid. But we've worked around that again. Like, let's not do it at this time. Let's do it at another time when everybody's feeling healthier. You know, there are ways you can accommodate people so that they can still be very highly functioning in their jobs and not feel like they have to keep part of themselves hidden from the workplace.
Yeah, and I really liked Michelle's comment too about leadership, and leadership leadership sets the culture, and really the willingness to show a little vulnerability, because that can really send the message that it's psychologically safe to get help when you need it. And I think that psychological safety is key. But Michelle, I'm interested in your kind of reaction to that woodwork effect idea, because I think it's very common for people to think that way.
Yeah, it actually, like, I tighten up when I hear that, because it's a fear that isn't going to be realized, right? To me, it's an excuse of kicking the football down the field and not needing to take the action. And I would say to organizations who have that fear, why don't you try it and see if it gets realized, because the chances are, as Nora said, 9 out of 10, even probably 10 out of 10, it won't get realized. There's no, I'm 100% certain of that, because I think the three of us are great examples. Is we want to be, relatively high achieving, productive workers. Our work lives gives us meaning, it gives us purpose, it gives us a place to go on a daily basis, it gives us a way to contribute to the world, to society, to an organization, and that's an important part of my mental health, right? But that psychological safety, and here's the other piece of it though, is when we provide mental health services in an organization, it isn't just for those people who have the mental health condition, it's for everyone, so that we can become way more familiar with the language of mental health. As Nora said, there's the struggle in her organization, yes, disclose, but oh, now she's out, oh, we're not sure what to say, is to give people the tools to know what to say, to have these conversations, and again, making the work environment safe. I'm prepping for another panel next week, and one of the panelists, I'm actually moderating, Darcy, so I'm taking notes from you today, is, he talked about that he's proactive with his team right away to tell them, I live with this condition, this is what my situation, this is how you might experience it with me, which makes it open for the team then to share back with him as the supervisor. So he's already creating a language around mental health for his team, giving himself safety as well as his team. So when we continue to see more of those types of things take place, these walls of stigma or hesitation will continue to come down.
Those are such great comments. I couldn't agree more. And I think, Bob, I'm interested in your kind of reaction to this woodwork idea that seems to pervade for some. And my experiences with many of the employers we work with, what happens is exactly what Michelle described. Try it, and when they try it, they realize, that it's really successful. So I'm interested in your reaction to that idea.
Sure. Well, first off, I just could echo or plus one or however you want to, phrase it, jump on the bandwagon with everything that Nora and Michelle have just said. The one thing that came to my mind, though, that I'd like to add to the mix is an employer may see a slight blip, a slight surge as people become aware or inspired or more confident. There may be a slight blip, but it's temporary at best, I think. And I think most folks want to come to work and be productive. Most folks want to come to work, be able to do a good job. I think there are very few people that want to come to work and take advantage of things like programs around mental health when they're not necessarily needing or deserving. So I don't know that you'd get a whole lot of abuse there if employers are worried about that. But the one thing that I would add is when having discussions with those employers about their fear of the woodworking effect, I might reiterate to them that, hey, you should look at this perhaps as an investment, because if you provide these services, if you raise this awareness, those people that are struggling, and estimates are that 25% of people have a mental health issue that's just not evident or manifested itself. But if you're providing these resources as an employer to people to help them be more productive, to help them be more comfortable, to help them feel more safe in the work environment, that's going to pay dividends in the end. And so the fear and the investment up front is actually minuscule compared to what it does for the employees, what it does for the entire company, and what it does for the entire culture.
May I add something, Darcy? I just, part of what we know from being part of the Stability Network is that, there really is evidence, unlike evidence that there's a woodworking effect, instead that if you provide people effective treatment, then there is less absenteeism, people are more productive, the fewer disability claims, fewer health insurance claims, because people are getting the care that they need and the support that they need. So it really it is a good return on investment, as Bob was saying. I would also say, when Bob and I chatted earlier, he works in security clearance, and I said, that's a difficult issue for employers. And I want to say, when I worked for the White House, the security clearance there, where you go through and the FBI investigates you. And one of the questions is, have you ever been hospitalized within the past 7 years for a mental health condition? And at that point, when I applied for that job, it had been longer than 7 years. So I felt really, glad it had been longer than 7 years, but discouraged that that would have disqualified me. And I have a friend who has bipolar disorder who did get disqualified for a job in the White House. And there are many jobs. I have a family member who works for a defense contractor who doesn't get help for his depression because he's afraid of losing his security clearance. And I'm always saying, isn't it worse to have someone in these high levels of authority that aren't being treated for their mental health conditions because they're afraid to disclose it? So I think that, for employers to rethink some of those where it doesn't become disqualifying, it's just a transparency thing where people can talk more openly about it, and maybe what would we do in this situation? Are there things that would happen? But I think that there can be, the fear can be justified that people have about not telling their employer, because there are ramifications from it. And I think that, again, as we were saying, people are healthier, they're more productive. If people need treatment, they should be seeking and receiving treatment, not avoiding it because they're afraid that their boss is going to find out.
Yeah, I'll add on to Darcy, with both what Bob and what Nora just said. I think about my own story and know that, it's taken me quite a number of years to get better. And what I mean by better, meaning that I can live more comfortably day to day, where my treatment plan works really well for me. Like Bob, I did a tremendous amount of research about my conditions, read a lot of different books to better understand what I was experiencing and so forth. And there's no doubt that when supported by organizations to be treated well, right, to have the right treatment,
Oh, Michelle, you have frozen. So, and I really wanted to hear what you had to say. So maybe we'll return to you actually, because it appears that you have frozen. But I think what we're talking about right now is really important. This idea that mental health, in depression in particular, but really any condition, can be kind of a taboo topic. So I'm wondering, I think a lot of people who don't have a personal experience or personal connection to mental health, to a mental health condition, depression or another condition, may wonder, if you're worried about someone, I'm curious about how you would want to be approached. If someone was worried about you and thought, gosh, Nora just does not seem like herself. I'm not sure what's going on. I'm really curious how you'd like to be approached in an empathetic, kind of compassionate way at work by someone who, let's say, someone at your same level.
Mm-hmm.
I'll start with you, Nora.
Okay. Well, what brought to mind is, and Bob talked about this a little bit with his anger. One of the first times I was approached was by a supervisor because I was very angry, and she had said to me, which is a sign of depression. Many people manifest their depression through anger, and she came to me and said, "You just seem so angry," and that a lot of people show their depression that way. And I was so angry that at the time that I couldn't take that information well. So it's like, "What are you talking about?" "Oh, I'm not depressed." But then after time went on, and I did, I really went into a major episode after that. I realized she was right. And she was gentle. And I think, having someone who was more my, rather than my boss, which made it a little more fearful, a peer could be less threatening to someone who's a friend there that might suggest, if the supervisor is the one who notices it, might find someone that they know that is a confidant to say, "Can you check to make sure he or she is okay? If there's anything, make sure they know about the resources that are available." Like I said, I've had people that on my team that didn't realize they could take accommodation. That's a right for them, the ability to do that. As we said with the American Disabilities Act and Family and Medical Leave, you can ask for accommodations. And, many people are afraid to ask for those things. And I think that making people aware there are ways that you can help and that you really do care. Did you know, maybe giving some information. Really, people aren't, they need to help themselves and feel like it is something that they need. But if there are resources available, too often people don't know that they have an employee assistance program, or, maybe having trouble finding a therapist. So where would you find a list of people, examples, or, peer groups are also a really great way for people to feel like they've got support. It sounds like at Microsoft, they have very strong, workforce support. Other organizations, mine's not that large, so we don't have that. But our health insurance covers group therapy for people that, are depressed or anxious. And certainly in the wake of COVID, there were many more of us than I think had before talked about our own struggles with mental health conditions. My hope is that's one of the silver linings of the pandemic, is that, people are more willing to talk about openly that sometimes it's a struggle, and getting support, having social engagement, going for a walk, meditating, taking time out of your workday. I've actually started instituting in my weekly team meetings, we have what we call mindful minutes, and I do it halfway through the meeting, not in the beginning, because there have been times when everybody's stressed out and people are snipping at each other and not being nice, and so it's like, we need to reset. Everybody needs to reset, and we're all have Zoom fatigue. And so we just turn off the cameras. I set a timer for 2 minutes. Everybody goes away, we come back, and it's amazing how much calmer everyone is just after 2 minutes of just like, get back in, do some breathing, think about, ground yourself, be here. You don't have to be mad at your colleagues. We're just stressed out. And little things like that can make a huge difference.
Yeah, that's great. Michelle, welcome back. We're happy to have you back.
My literally turned off.
Okay. That happens.
To all the audience and my darling panelists here, that my computer literally just went off.
It's the world we're living in right now. But I'll go to Bob quickly and then to you, Michelle. We're talking about this idea of, if you were experiencing a challenge, how would you want to be approached by someone who cared about you? How would you like someone to kind of approach you, whether it's a peer or a supervisor or whomever at work? So Bob, we'll start with you.
Sure. So I was thinking as Nora was speaking and reflecting on your question, Darcy, that, I think I'm more receptive when somebody comes to me and they're being honest and open and forthcoming about themselves, right? And so I think the approach that would work for me and that I've tried to leverage with other folks about whom I have concerns is to go to them, in a neutral environment. Let's go have a cup of coffee. I don't want them coming to my office and standing in front of my desk like they're on report, right? Or I don't want to come into their office and stand over them, intimidating them while they sit at their desk trying to do their job. I say, let's take a break and go get a cup of coffee. And at some point in that conversation, then what I like to do and the way I would like to be approached is to say, hey, look, I've been seeing some things lately with you that have me concerned. I care about you. I'm worried that you're struggling with, the pressures or the idiocy or the time commitment. You're running a marathon at a sprint pace, and I worry about you. And I'm here if you want to talk to me. I've had similar experiences. Maybe I might relate something that a therapist shared with me. My therapist told me that A, or I learned when I was talking to my doctor B. That lets them know overtly and somewhat covertly, if you will, that I'm experiencing issues too, and that I'm coming from a place of honesty and openness. And then I tell them, hey, if you want to talk to me, I'm here. But if you don't want to talk to me, there are other resources that you can go to, and EAP and therapy. And so I just kind of set the stage that, hey, I recognize something's going on. I've been there. I'm here to help. and there are other people around to help too. And then I kind of leave it at that. And then they have to digest on that for a while, and figure out what they're comfortable with. But I've laid out options. I'd like to have those options laid out for me. And I find that that's comfortable both on the receiving end and on the delivering end.
Yeah, I really like this idea of saying, this is what's worked for me, or this is what I've been told to try. I mean, that really opens up the topic based on your personal experience to really, I mean, you're sharing and showing a little bit of vulnerability, which I think is really important. So that's fantastic. And Michelle, how about you?
Yeah, so, you know, it really gave me pause to think about, you know, what would I want someone to say to me? I think what's interesting is it really does make me reflect on those major episodes. And, you know, when I was in the throes of my episodes, I don't honestly know if someone could have said something to me that would have been helpful, because I was so unwell in those episodes, and it was so jarring to me that it almost it becomes hard for me to hear almost anything people might be saying to me. However, that said, certainly, you know, someone approaching me, a boss, a colleague, or whatever, saying, hey, it doesn't seem like you've been yourself these last few weeks or this last while, you know, because they probably experienced me differently when I was in a better place, right? So you don't seem yourself. You don't seem to be the Michelle that I've come to know and care about and respect as much as something might be off. You know, I'm here if you'd like to talk to me, and also hopefully to make me aware of other resources should I not feel comfortable having a conversation with that particular individual who's coming forward. But once someone cracks the door like that open to any of us who are struggling or feeling challenged, there's a likelihood that we'll come back around, that we will come back around and take advantage of that opening, because we need help. And so that's an offer of help. Even though we may not be able to accept it in the moment, it doesn't mean we won't be able to accept it in the coming weeks or months.
Great. I really, that idea of kind of coming back around is a great one. Okay, I just checked. Apparently we have a ton of questions from the audience. So this is my last question. What one thing would you say to someone who may be experiencing depression and not getting help for it yet? So I'm going to start with Bob, and then I'm going to go to Nora, and then I'm going to go to Michelle, and then we're going to go to the audience.
I think what I would say is it's more common than you think. You are definitely not alone. I would, you know, draw a parallel to the number of people that have allergies, or the number of people that have migraine headaches. There's no shame in getting treated for either one of those. There are numerous television commercials for numerous pharmaceuticals that deal with all of those things. So, you know, when you look at it in those numbers and at that scale, it's nothing to be ashamed about. And the benefit of doing something now rather than letting it fester, letting it evolve into something that can't be controlled or that is extremely damaging to yourself, it's worth dealing with it up front and at least investigate it. And if it doesn't resonate, that's fine. But odds are that if you've got the issue, depression, anxiety, PTSD, and you talk to somebody about it, it can be validating. It will be validating, and then it allows you to go down a path.
Fantastic. Great response.
So I would say, you know, that you can get better, you can recover. You think right now you can't, and I think one of the things I learned after my third episode was the more often you have depression, the more likely you'll get it again. That's a fact. Your mind just sort of goes there, and that was, you know, very sobering for me and upsetting. But I'm having to accept that as part of who I am. but it also is a reminder I have. And when I'm in my depths of despair, I don't think I can get better. I don't think I'll feel better. But my family members know that I've gone through this before and I've recovered and I've gotten better again. And so I think that's one of the most hopeful things, is to say, you know, I've been through it and you're going to get better. Not the same things work for everybody, but you can get better. And I think that's a really important message for people to hear when they're experiencing, you know, a really severe episode, to understand that there's hope, there's different therapies that work for different people, that you keep trying things, that you're worth it, that your family is worth it, that the worst thing you could do is end your life. The people in your family will never get over it. The people who love you will never get over it. So your depression may be telling you that's the best thing to do, but it's lying to you. And you need to know that you can get better, and people around you really want you to get better.
Excellent.
I echo everything that Bob and Nora said. The last thing that I'll add to it is from my own experience is, like Nora, I'm on a second marriage. We just celebrated 9 years together. We live north of New York City, right on the Hudson River. I have a Bernese Mountain Dog. Had I believed my depression, I would not be here today to enjoy and thrive in the life that I have, and I would have missed out on an incredible amount of life. And I think for your audience, this is what's so important, is the three of us are here as living, walking proof of living with a mental health condition, being honest about the ups and downs, that it isn't every day a bed of roses, that there certainly are challenges with what we live with, but we are living well. We have treatment plans, we're living well, and we're here. And I'm so grateful that we're all here. And that would be the last thing I'd like to leave your audience with.
Wow, I could literally talk with all three of you for another hour, but I know there are questions and I need to turn it over. Thank you so much for helping us change the conversation. I'm going to turn it back to Sean. He's going to field the questions, and thank you again. Awesome conversation. Take it away, Sean.
Hi, Emma, can you put the slideshow back up for 1 second, please? Thank you. Before we get to questions, I just wanted to thank our sponsors and the generous support that they give us, Takeda and Lundbeck, who have made Right Direction possible, and they make it free for anybody who would like to use our materials. Next slide, please. I would like everyone also to join us for next month's virtual town hall, which is how to make every month Mental Health Month. And that'll be on May 26th at 1 p.m. Eastern, and we have below the site where you can register. Okay, now for questions. One of the questions that I had was whether any of you have used your employer's EAP, and was it effective, and what could you do or what could you, I guess, recommend for it to be more effective in the workplace? So maybe we can start with Nora.
I've only tried to use my EAP once, and it wasn't effective, unfortunately. But so I would say the thing to make it more effective would to somehow establish a more ongoing relationship with someone who knows me rather than just responding to me in a crisis. I've found that kind of therapy has been helpful, that people can know that. And so if there are ways that you can be connected with someone on a more regular basis to help you in when you're stable and when you're unstable.
Bob, what are your thoughts on EAPs and your experience with them?
I've used EAP. When I had one of my first anger incidents, I used our company's EAP to find a therapist to talk to. And that was kind of my introduction to therapy. You know, in our EAP program, you were afforded 3 meetings with a therapist, and that was enough for me to A, see the value in therapy, and B, establish a relationship with that therapist to talk through some of the things that were going on. Now, that being said, as I learn more about myself, learn more about my issues, learn more about mental health, I recognize that I was dealing with certain things that this particular therapist was not necessarily best qualified to address, and I transitioned to a different therapist at that point. But it was the EAP system that gave me somewhere to go, somewhere to see the benefit of the therapy, and somewhere to at least start a trial relationship with a therapist to see what could be gained from it. So I'm a big proponent of taking advantage of it if it's offered.
Michelle, what are your thoughts?
Yeah, I like what Bob shared. I myself did not fall into EAP when I went through what I went through. I was in such crisis mode already, and I needed a complete treatment team and outside help and a medical facility. But I would say that, certainly ensuring, and Sean, we talked about this before it started, is help partnering with your EAP and modernizing their offerings. I've heard recently Target, went from offering 3 counseling sessions to a monthly counseling sessions for all their employees. So there are ways to up-level your EAP's offering. A lot of those offerings are free, and you should be taking advantage of them.
Great, thank you. I think the next question really surrounds how managers and supervisors can really interact better with their direct reports, on how, what are some of the, I guess, the strategies that you've seen that you feel are really, strong strategies to effectively deal with employees that might be going through something. And maybe if you could share a quick experience about maybe what's a manager said to you that maybe really helped you feel, more secure in your role and also just psychologically safe. Michelle, do you want to go again?
Absolutely. I'm going to keep sort of sounding like I'm repeating, but it's really demonstrating that empathy and active listening, and certainly not putting anyone on the spot in a group setting, but carving out the appropriate one-on-one space to have a conversation of concern. And I love what Nora offered before, and I think that's a great management tool, which is just in the middle of a meeting doing mindful moments, because that starts to already say, it's okay for us not to be okay, and to acknowledge that in the moment. So I'm going to leave it there because I thought that was really rich and a great action people could take.
Thank you, Bob. What were your thoughts on maybe a supervisor or a manager who's really impacted you in terms of dealing with some of the issues that you might have faced?
Yeah, I was thinking of a couple things, one individually and one from a group perspective. I mean, individually, I kind of already spoke to how I was approached and how I'd like to approach people who I am worried about or who I'm concerned about because I see a change in their behavior or their affect. So I don't want to go into that again and beat that horse, but I do think it's important to approach people from a place of genuineness, right? And then one of the other things too I was thinking about is in one of our team meetings a while back, we were all struggling with, and we have a fairly large group, but we're struggling with the whole work-life balance thing and the various stresses associated with that. And the fact that right now we all live in our office because we're all working from home and there's no demarcation, the lines are blurred between work and home. And one of the things that our team did was just sit down and say, okay, everybody's going to talk. Who wants to go first? I want your best and favorite coping mechanism. And as people started sharing their coping mechanisms for dealing with this mutually shared frustration, it made the team more comfortable with talking about their own personal experiences. It helped them see that that they weren't alone. And it also did provide good resource referral, good tips and tricks for people to use. So in essence, it became a group counseling session, a group therapy session, without it being a group therapy session. And everybody walked away from it and said that was the most valuable part of our team meeting that month. So there are ways to address it that are, again, subtle, and there are ways to address it that are direct. And I guess the key is just understanding when one is more appropriate than the other.
Nora, Do you have any thoughts on this, additional thoughts that weren't spoken by Bob and Michelle?
Yeah, I mean, I think, Bob's both had excellent points, of course, and in addition to mindful moments, one of the things we do is have a question of the month, and it can be anything from what's your favorite ice cream to what are your coping strategies. And I think that for what I've admired in supervisors and leaders and then try to emulate myself is for leaders and supervisors to show their vulnerability, that they too are coping, that this isn't easy for any of us to work at home all the time and not have that, distinction between work and home, or those, my kids are out of the house now, but I know that I have staff members who, not only are they working at home, but their children have been at home for all these months, and recognizing that they're under more stress. And as Michelle said, talking to them one-on-one more, like, is there something we could do? Is there a better time of day that you might want to do this or work on this? Because it's just, these times we're living in right now are unprecedented. None of us have gone through this before. And I think it does offer that option to open up that conversation, but also to try to emulate good practices for everyone.
Okay. Well, thank you so much for taking the opportunity of your day to speak about your experiences and best practices, and we really appreciate it. Please visit our website at rightdirectionforme.com, and thank you very much for attending.
Thank you.
Thank you.